products, but
Welcome back. We're going to just give everybody a minute to leave the last session and filter on in here.
And I'm going to go on mute because Eileen is emceeing the next session and I don't want to interrupt that.
Okay, welcome back, everyone. I hope you all are having a good afternoon. I know it's been a busier schedule today than yesterday, but I hope you're getting a lot of good information. This session is with Kevin Lenaburg. He is the executive director for the Coalition for Headache and Migraine Patients. He has worked in public health for more than 20 years or almost 20 years. I'm not sure which it is.
It works.
That
works. About 20 years.
About 20 years. And Kevin is also, he's my boss. And he is pretty much the best boss you could ever ask for. He has helped me in so many ways to bring my dreams to reality as far as helping the people living with migraine that I do. But he's also been a huge supporter of the entire cluster headache community and the entire headache community as a whole in his role with the coalition. And so I'm really excited that he's here today to tell you more about what the coalition has done. And thank you, Kevin. Take it away.
Great. Thank you for the introduction, Eileen. And you are a phenomenal person. You're a phenomenal person to work with. And I'm honored about the work that we do. And for those of you who don't know, we largely copied Cluster Busters and the conference you all are participating right now and brought that amazing thing that you all are a part of over to the migraine community. So a lot of what I'm about to present on is how we are doing things in the migraine community, and we're treading new ground. And that creates opportunity and efficiency for Cluster Busters and the cluster headache community in general to do those things. But this is one of those examples where it actually went the other way. And we borrowed from you all. And I just can't say thank you enough to Eileen, to Bob Wold, and to all of you who make this incredible organization and conference. Next slide. Okay, so I want to start off my talk by briefly acknowledging this community. All of you are amazing. You have what is widely recognized as the world's most painful disease, and yet you persevere. You push through. You find ways to survive in spite of all of the challenges that you confront, which are a terribly painful disease. It's not well understood by medicine. There are not nearly as many effective treatments as you all deserve. And those that do exist, for ridiculous reasons, there are policy restrictions that keep you from having the easy access to all of those medicines that you should have. So it is a tough road that you are all doing, but yet, and through all of that, you found each other, you've created this organization, you're a part of the Cluster Busters community, you're here at this conference, you are thriving, and you're doing amazing things. So I just want to start there. And this is a sign that I drive past in my neighborhood, and seeing those mushrooms always made me think I wanted to pull over someday and take a photo and just show that message that really the universe is conspiring. And what I want to basically share with you all today is how all of this broader headache patient advocacy work that we're doing together, and acknowledging we primarily, honestly, are focused on migraine. It is a bigger community. There's a lot more innovation happening right there, but we have wins for cluster community along the way. And a lot of the work that we're doing now can be leveraged and can be done in its own way and can be done efficiently and better for the cluster community because we've worked out the kinks with the migraine group. I do welcome your questions. I'm going to go fast. Please go ahead and put them in the chat function, and I will get help from Eileen and from Andrew, making sure that they prompt me with those questions at the end. And as much as we have time, I will answer as best I can every question you have, and then we have time for. Next slide. So CHAMP, we're a coalition. We are largely nonprofit organizations. We have a couple key bloggers, or we call them patient opinion leaders, and then some of the migraine communications companies, migraine.com, Migraine Again, and the Migraine World Summit. And we bring all these people together with the belief that when you have all of these leaders in the same room and they're meeting each other, they're forming relationships, they're talking about the work that they're doing, we can find ways to work together. We can recognize who has certain skill sets and lanes that they own. We don't need to waste our time and energy being duplicative with that. We can support them in what they do, and vice versa. They can support others in what they do. Champ's biggest goal is to bring all these people together, foster these collaborative dialogues, and figure out how working together we create wins for everyone. Next slide. So we're going to give an update on what Champ has been up to. And it's not just Champ. This is the broader efforts of the migraine, headache, and cluster advocacy community. Next slide. So in the community realm, like I say, we bring people together. It's primarily migraine-focused organizations, but we do have cluster busters as well as the cluster headache support group that are part of our coalition. So out of 21 members or participants in our coalition, we have 2 of them that are cluster focused. So it is, certainly a minority, but it's an important minority. And you'll see there's wins because they are a part of the coalition. Champ has recently in the past year hired a communications director who is focused on earned media, traditional PR, working through media so that we can get our messages out and we can reach people who are not already an active part of our cluster or of our community. And I got to say, like, the cluster headache community has so many of the resources in place: an incredibly painful disease that is not well understood, a treatment option that is interesting to so many people, psilocybin and other psychoactive substances. There's an amazing, interesting story to be told. And I know in certain ways it is being told, but the PR person of Champ absolutely can help to bring this attention to the cluster community. And then in our Migraine and Headache Awareness Month, we focused on a new era of care as our theme for this year. We have a different theme when we're focusing on all of the innovations. So, okay, here we are. So we are doing a process through Champ called Mapping the Migraine Patient Journey, where we've figured out that there are 15 broad steps in the migraine patient journey. Now, it's not linear. Everyone doesn't start on step 1 and finish on step 15, which is being diagnosed and having effective treatments that uniquely work for you. That is the end goal that we want to get people to. Now, the steps in between, sometimes people, they skip a step or they go back. So it's not linear, but by organizing it in a fashion that we had these 15 clear steps, we were able to figure out where are the gaps. Where are we losing people along the way, and begin thinking about how, as a community, a patient advocacy community, we can start to fill those gaps. And the 2 things that we found were most important were up front, we're missing a lot of people who have migraine and don't realize it. They think they have sinus headache or tension headache or just general headache, and they don't realize that it's actually a migraine. They have never been diagnosed. They don't have access to treatments. So we are trying to make sure that we do these public education, PSA style awareness campaign to reach them. And then the other problem is there aren't enough healthcare providers who are knowledgeable, compassionate, willing to diagnose and treat people with migraine. They try to refer them up to neurologists or a headache specialist, but there just aren't enough. There are less than 1,000 headache specialists in America. And with 40 to 60 million Americans who have migraine, that is not enough specialists to take care of them. So we need the general practitioners, the family docs, the nurse practitioners, the physician's assistants to increasingly be willing and recognizing. And this happened in the diabetes world. Used to be that diabetes was something that was not handled by a family doc. They would always get referred to a specialist. And then as diabetes exploded across America, they realized there aren't enough diabetes specialists to treat them. And so the family doctors were convinced that they have to take on that responsibility. They now do it. They do it pretty darn well. And we need to do the exact same thing for headache diseases. We're starting with migraine, but there is a definite pathway to do this similar process of mapping the cluster headache patient journey, figuring out those gaps. And part of it will absolutely be recognizing we need to be doing better training and explaining to more healthcare providers what is cluster headache. Stop misdiagnosing it as migraine. Get it properly diagnosed and start connecting them with the full range of treatments that people with cluster headache need to know about. Another thing that we did this year is we revamped our website And we definitely have a page on cluster headache, and it has enhanced information there. And we're always working with our partners, Cluster Busters and Cluster Headache Support Group, to make sure we're highlighting the best of their content, and the information we're putting out there is as medically accurate and helpful to patients as possible. Next slide. So on the advocacy side, this past year, 2020, everyone in society recognized there was a lot going on around recognizing the racism in our society and the racism in the healthcare system. And so we created an initiative called the Disparities in Headache Advisory Council. It's multi-stakeholder. We have patients, we have patient advocacy leaders, and we have healthcare providers who all say, we want to try to make sure that we are providing better headache medicine care for the BIPOC, Black, Indigenous, people of color community, and that we want to make sure that our community, the people who come to our events, the people who are part of our social media followings, better represents who actually has this. Over in the migraine space, disproportionately, who comes to our retreat migraine event that's going to be next month is older white women, which there's a high prevalence of migraine there, but it is not fully representative. And we need to do a better job reaching out to, engaging, and welcoming these other people that are experiencing migraine so that our community looks like the true prevalence of these diseases. And so we did a seed grant program. We awarded $120,000, and Cluster Busters applied. I'm pleased to share that they earned a grant through this, and that is focused on helping them to reach out BIPOC communities and get more individuals with those characteristics to be a part of the Cluster Busters community and participating in the Cluster Busters conference. We also work together to create a strategic plan focused on policy advocacy. It's something we've been working on for years, but we decided we needed a long-term plan instead of doing it year by year. And so we created a group called Head Pain, is how it's pronounced. It's the Headache Disease Policy Advocacy Network. It's led by the Headache and Migraine Policy Forum. They really focus on treatment access, as well as the Alliance for Headache Disorders Advocacy. They're the group that organizes Headache on the Hill every year. And Bob Wold and I both serve on the executive committee of AHDA. So there is a strong input representing the cluster headache community and trying to make sure that the policy issues that are important to cluster headache are given real strong attention by AHDA. And then, like I said, CHAMP is listed as well. We put out this plan. In the plan was included saying that we are all going to work together in support of increased access of oxygen for cluster headache. It is ridiculous that CMS is not supporting that. We've made some incremental progress. CHAMP helped to fund a research study publication that was useful in getting them to make an announcement showing some movement in the right direction. Unfortunately, it's proven to be a bit more complicated, and we're pushing back on the direction they're going, which is a step in the right direction, but not the exact step that we wanted them to take. And so again, Eileen and Bob are strong leaders who are, by working through AHDA and CHAMP and others, able to marshal a lot more organizations, a lot more voices, and a lot more heft in support of the priorities of the cluster headache community. And then there was also these new guidelines put out by the American Headache Society. They were focused on the new treatments for migraine, and we weighed in on those. Next slide. So that's what we've been doing so far. Real quick, what we're still doing for the rest of this year. Next slide. When we think about community, we're going to have another meeting in person in Scottsdale. We're going to continue our earned media work. We did a patient survey. We did get a decent number of responses from people with cluster headaches who are working with Bob and Eileen to review the results from the cluster. It's a little complicated because always it's like, is that a real person with cluster, or is that someone? We have some concerns. Some people with migraine might have said, oh, I have migraine cluster, which we know is not a thing. It's a misdiagnosis or a misunderstanding. So we're working through the data, but there may be some good data in there that is aligned with the policy and advocacy goals of the cluster headache community. And we're going to try to push those out to bring more attention to cluster headache. And then, like I said, we have our migraine conference coming up next month. It is built on the Cluster Busters model, and we're just so lucky to have your conference leader, Eileen, be our retreat director. So thank you to the cluster community for sharing her with us. Next slide. On the education side, we've created an initiative called Migraine at School. And while the name is Migraine, transparently, that's it. Because of the involvement of Eileen and Bob Wold and them saying, hey, we should make sure that cluster is also part of the curriculum that you guys are creating for schools as they're training about this. And the screener that we have, that's in there. So and you'll see on the next slide, but not yet. And then on the mapping the migraine patient journey, we have actually created public awareness advertisements that are focused on migraine, trying to educate people. What is migraine? How is it different from a normal headache? What they should do about it. Go see a healthcare provider, share the following information, ask for a diagnosis, and to begin a treatment plan that's right for you. We've created these ads. They're running digitally in 4 cities across America. It's sort of our trial effort. And we're thrilled about how they turned out. And this really has created a template. We figured out how to create these ads on the cheap. We're figuring out how to get them out there. We're going to do a nationwide PSA campaign next year so they can actually be not just on digital platforms, but hopefully on mainstream television. And all of this can be shared, will be shared with the cluster headache community saying, hey, this is how we did it. This is what we've learned. This is how we figured out how to do this cost effectively. And we're just turning it over and saying, here's how you guys can start doing this to build awareness of cluster headache. We also have an initiative called Head Ed, which is bringing together all the different training resources on migraine, whether they're a CME course or a non-CME course for healthcare providers. And we've created that. It's on our website. I'm actively working with Bob and Eileen to figure out, do these training resources for healthcare providers exist for cluster? Can we find them? Can we add them to this database webpage? Or if they don't exist, how do we work together to get them made so that they are available, so that there will be more doctors who are willing, knowledgeable, trained in how to diagnose and treat cluster headache and help more people with cluster headache. And so we're going to have our next meeting right before that American Headache Society meeting in Scottsdale. Next slide. And again, I encourage people, if you have questions on anything I'm presenting, please throw them in the chat and the moderators will help me to make sure I address those at the end. Our DIHAC, our Disparities in Headache Advisory Council, has put together an issue brief bringing attention to how people who are of BIPOC, they have worse outcomes for a variety of reasons, history, structural racism, you name it. Not only do they have, whether it's migraine disease or cluster headache, they have less access to the healthcare system, and that leads to worse outcomes. As we're bringing attention, we've gone through the data to make a real data-driven case and saying what we're doing to try to address that. The different 7 projects, including the one that's being done by Cluster Busters. We are working on the CMS oxygen issue, and I don't have, unfortunately, a clear success story to tell there, but we're making progress and it is a priority. And we're trying to make sure that telehealth, which was something that a lot of people turned to during the pandemic, remains available afterwards, because a lot of people found that it's just so much more convenient to do the appointments via telehealth. And via telehealth, you can find and connect with the right experts for especially a rare, less understood like cluster headache. So I think telehealth access is really important for the cluster community. Next slide. Looking ahead, what is CHAMP going to be doing next year? Next slide. So these are our sort of key priorities. We have a lot of projects, a lot of things. First one is about how do we reach and motivate more people with headache diseases, migraine cluster, and others to recognize that they should do something about it. So many people are just sort of grinning and bearing it. They're doing what they've always done. They don't realize this is a new era of care. There are more treatments for migraine as well as cluster headache than ever before, and they should absolutely be going to the right healthcare provider and getting the right treatment to help them live a better life. The middle pillar is about those HCPs. We don't want to send a bunch of people to doctors who then aren't willing or aren't trained to diagnose and treat migraine or cluster or other headache diseases. So we got to make the case and we got to provide those training resources so we can connect patients with the healthcare providers that are going to help them. And the last thing is the community part. CHAMP's role in all of this is to bring people together. We are a convener, and our belief, our theory of how we change the world is that by bringing everyone together, getting people to understand what people are doing, is how we support each other's work, how we force multiply, and how the cluster community buy. And I know there's some people who feel like, hey, are we getting enough? Do they focus too much on migraine? What's in it for us? And I'm trying to make the case that I really believe that you are a valued part of this broader headache community, and that by staying with us, you have more allies on the fights and the progress that you're trying to make. So that's why I'm thrilled to be able to work with Bob and Eileen. In addition to just being amazing leaders and people, they do really important work, and it's a fantastic working relationship. Next slide. So where do I see the opportunities moving forward with the cluster community? Like I say, we're doing a migraine awareness campaign right now. We're going to plan to turn it into a national PSA next year. All of that will have insights, learnings, efficiencies that we can share with the cluster community, so you guys can think about similarly doing your own ad campaign, digital or PSA style, to build more awareness about cluster headache. Our mapping process, the same thing can and should be done for the cluster patient journey, so you can find how it differs from the migraine patient journey. And it absolutely does. A lot of people, they're like, oh, I got these headaches for years before I ever saw a medical professional. As you all know, the first time you have a cluster headache, it is such an intense pain that almost all of those patients are immediately going to the medical system. The problem is not that they're not going to the medical system like it is with migraine. The problem is they go to the medical system and the medical system doesn't fully know how to help them. They're not knowledgeable enough to diagnose cluster headache, or they don't know about all the appropriate treatment options that they should be educating the patients about and finding what works right for them. They have to really, unfortunately, do their own Dr. Google search, find an organization like Clusterbusters and a conference like this, and then finally get the information that they need. And that's just not fair. The medical system should work better than that. Our website, we always making adjustments to it. And so if any of you visit our website, it's headachemigraine.org. You'll see it says headache types, and there's a page about cluster. If you see something on there that you think is either wrong or missing, and if you were a cluster patient who found this and there should be something else there, please let us know. And we are always looking to make improvements. And then we can always do, more amplification around Cluster Headache Awareness Day, bringing together the resources of the whole CHAMP coalition to help get the word out, using the PR professional, our comms director, and JAMP to engage earned media. So those are just some of the ways off the top that I see that already the cluster community is getting benefits by being a part of this broader headache community, and that I think that moving forward, we can continue to partner so that we're helping more people with cluster. I think that's the last slide, and we can now open it up to questions. Do I have an MC who can help to moderate any questions for me?
Hello.
Welcome back.
All right. Well, we haven't received too many questions, but I had one from the audience. There's one. What's the URL address mentioned? I guess that's for CHAMP.
Yeah, so it would be headachemigraine.org. And if someone can type that in the chat box, and you'll go to our main webpage, and up at the top, you'll see in the navigation, headache types, migraine, cluster, I think other. And you can find that cluster headache page. And if someone wants to throw the specific headachemigraine.org/cluster or whatever that URL is in the chat, that would be helpful as well.
So another question that I had come into me privately, weirdly for some reason, which is fine. So they asked about migraine at school, and while you mentioned that is going to include, or it is including, cluster headache, will that include other headache diseases as well at any point? Are we going to add other TACs and new daily persistent headache, or are we going to stick to cluster and migraine?
It's a good question. I don't have a clear answer right now. CHAMP is early phases trying to bring more attention to other headache diseases. I had this vision as much as, we were building off Clusterbusters, and we created a similar conference for migraine, that my thinking was I would love to create a conference for all the other headache types: new daily persistent headache, Sunct Suna, trigeminal neuralgia, and there's many more. And unfortunately, there's just, there's so many things to do, did not have the bandwidth or the resources to organize an entire conference dedicated to that. But there's another organization, the Association of Migraine Disorders. They just had their annual conference last week, excuse me. And they created a 2-hour block that they gave over to CHAMP. They said, we know you want to bring attention to these other headache types. We're broadly supportive of that. Why don't you fill this? And so we did. We covered. We brought together a physician as well as a patient living with trigeminal neuralgia, Suna, new daily persistent headache, as well as, and I'm blanking on what our fourth one is. If Eileen or Caitlin
was
want
it
to
hemicrania continua?
Mm,
Or no? I don't know. I
I
know
don't
that
know.
Alan Kaplan, who spoke about it, is in our audience right now. So hi, Alan.
Hey, Alan, who did a fantastic job with his presentation.
CSF leak. Sorry to interrupt. CSF leak.
See, that's right. Yes,
Yeah,
the spinal CSF leak, right? So there's we're in the early stages. We're trying to figure out how we're helpful. We certainly don't want to step on toes. We recognize that, when it comes to trigeminal neuralgia, there's the Facial Pain Association, and they do incredible work. So our goal is not to replicate what they do. It's just to help more people find them and get to the right resource. But then when you look at something like SUNCT and SUNA, there's a Facebook group that has a lot of great information there, but there is not a nonprofit organization. There is not a website devoted to that. So we're trying to advance the ball a little bit there, and we want to be a good partner. If someone in that community says, I want to create the nonprofit organization for SUNCT SUNA, but I don't know how, and I'm going to need some help getting there, CHAMP can bring our resources, our knowledge and expertise in partnership with them to help them get there. So that's the type of work that CHAMP does, where we try to figure out how do we be that value add force multiplier to help everyone with whatever headache type they have to be doing better at what they're trying to do, which is helping people with that headache type to live better lives. And going back to migraine at school, we're not quite sure how it's all going to integrate. It gets a lot to start explaining in a curriculum for children, all these different headache types. But yes, like our screener, we tried to make it broad enough. It started just as a pediatric migraine screener. And because of the input of Bob, Wold, and Eileen, we changed it to a pediatric headache screener. We didn't want to exclude, or we don't want to limit it to migraine. The hope being that if a child, adolescent who has cluster headache would get caught up in the screener, would be directed to go see a pediatrician or hopefully a pediatric neurologist who would be able to accurately diagnose them and start figuring out what are appropriate treatments for someone who is a adolescent or peds. So that's the answer to that question. Do we have more questions?
Yes, we do. So thank you for that answer. Also, any advice for trying to get my insurance to cover O2? And I know that your answer is probably no, but I was thinking when I read this question that like we have those access guides for all of the CGRPs and stuff. And I say we, like I'm like CHAMP, but
Eileen, you are a part of CHAMP. You can say we.
All right. I'm wondering if we shouldn't partner with Cluster Busters, the other we that I am this weekend, to maybe try to start to put together an access guide for oxygen, considering the fact that more people are going to have access to oxygen soon. I've decided this, regardless of whether we actually know. I've just decided it's going to happen.
Yeah, just like we just decided via text this morning with you, me, and Bob that we are going to make sure, if it doesn't already exist, that we're going to work together to create a HCP training course for a cluster. That doesn't mean that CHAMP is making it. That's not our skill set. But in our coalition, maybe it's the National Headache Foundation. Maybe it's the Association of Migraine Disorders. Both of them have created amazing resources, educational resources for HCPs focused on migraine. They have templates. They know how to do it. And because they're part of CHAMP, we have relationships with them where we can start a conversation and say, hey, would you be willing to create these same educational resources for HCPs around cluster headache? And will you do it in partnership with Cluster Busters and with the support of CHAMP to make sure that the information is medically accurate and includes all the things that Cluster Buster knows HCPs need to know about cluster headache.
Yeah, and that's kind of the beauty of having a coalition where we can use everybody's talents, which is what you've been saying.
Yep.
I
like it when you say exactly what I said. It really validates me. So I just want to thank you for that.
I agree completely with you. We have time for one last question. Has CHAMP published any education in regards to the erroneous term cluster migraine? You brought it up earlier. Have we published anything about it?
I'm trying to think if we have. It's definitely been part of our retreat migraine conference, which is focused on people with migraine, where there's been some talk about, stop it. That's not a thing, guys. Like, you don't have cluster migraine. Now, there is overlap. That we see this with all headache types. If you have one headache type, you are disproportionately likely, unfortunately, to have another. So it is true that there are a number of people who genuinely have migraine and they genuinely have cluster headache. But those people don't have cluster migraine. That's not a thing. So again, it's an interesting question. I can't think of a specific communication, but we are always creating new content. CHAMP doesn't do a whole lot of content creation. That's largely what our coalition participants do. But I could see, for example, Cluster Busters deciding to write a piece in partnership with CHAMP, bring our resources to bear about this, and then we do what we normally do, which is to amplify, to help get more people aware of it, to get more eyeballs on it.
That's awesome. Andrew, I know that you're listening, but not on screen. So you should tell Ashley that she should write that piece, and then
Yes.
we'll publish it. We'll pay her to write it, and we'll publish it.
Yep.
So
we want Lucy listed as a co-author on it.
Yeah. And sorry about your slides. Lucy picked up the mouse in the middle of your presentation and threw it. Well, Kevin,
yeah, although we did have a slide, now that I think about it, showing that pediatric screener for migraine at school, but we zipped right past that one.
Lucy didn't like it. She didn't approve. All right.
Lucy's in charge here. I just do as I'm told.
All right. Well, Kevin, thank you so much for being with us today. I can't wait to see you in a few weeks and get back to bottling some wine.
Thank you so much. I really just want to again say thank you, Eileen. Thank you, Bob Wold. Thank you, cluster headache community. Again, I recognize and respect the hard road that you all are on and the extra challenges from the policy side, the public awareness, lack of public awareness side, and we're committed to trying to be a strong and good partner with you to make progress on your priorities. So thank you all for what you do, and our collaborations will continue.
All right. Have a good afternoon.
Thank you. Bye, everyone.